Good morning, students. So today's class we are going to study about the kind of bioelectric signal called ERG. ERG is electroretinogram. So we are going to study about what is electroretinogram, its signal characteristics. So the study of electrical activity of the retina, we call it as electroretinogram, and it is used in clinical purpose as well as research purpose. So if you are going to use this ERG as a research purpose, then in that case we have to use implanted microelectrode. It will be placed in the retina, and a reference electrode called indifference electrode. It will be placed over the temporal lobe, that is near the ear, as a reference electrode. Suppose if you are going to use the ERG for a clinical purpose, in that case, cornea electrode is used. This cornea electrode is nothing but it is a kind of a contact lens which is placed over the retina, and a reference electrode called indifference electrode, it is placed near the earlobe or in the forehead. And if you see the ERG signal, it is composed of four components, four waves. Those are A negative, B positive, C positive wave, and D negative waves. This A wave and C wave, so it is originate from the cornea part. Then B wave originates in the bipolar cell region, and D wave, it is associated with the termination of stimulus. And if you see the voltage range of the ERG signal, it is 0.5 microvolt to 1 millivolt range, and the frequency range is 0.2 to 200 hertz. So if you see, this is the actual ERG waveform, so which consists of A wave and a B wave. You can able to see the A wave is negative and B wave is positive. So that's why we call it as a biphasic waveform of a ERG. This waveform is for a normal patient. So this picture shows how we measure the amplitude and the time period for this ERG waveform. So the amplitude is measured here. It is indicated by orange color stand like thing. Both to measure the amplitude of the A wave as well as to measure the amplitude of the B wave. So you can able to see that starting from that baseline to the bottom negative part of the A wave. So we are measuring the amplitude of the A wave, and the amplitude of the B wave is measured from starting from the positive amplitude to the negative amplitude. We call it as the peak to peak wave of the B wave. So we have measured the amplitude of the B wave, and the time period is measured as the starting from that initial point to this till this A wave point. This is the time period for A wave, and the time period for B wave is starting from the point peak point of A wave to the peak point of B wave. That is the time period which is determined for the B wave. So this time it is referred to as implicit times in the case of electroretinography. And if you can able to see, these are the layers of the ERG signal. So in the different layers of retinal layers, so we can able to see these are the pigment epithelium cell, which is the topmost layer. Below that we have the rods and then cones. You can able to differentiate the rods and cones here. Then below the rods and cones we have the bipolar cells, and below the bipolar cells we have amacrine cells, and then followed by the other regions. So here the A wave and the C wave, it is associated with this cornea part, and if you see the B wave, it is originated in the bipolar cell region, and if you see the D wave, it is located in the that is termination of the stimulus. And this is how this picture shows the how the ERG waves originates. A wave, B wave, C and D wave originates in the from the retinal layer. And if you are able to see that here, that what are the electrodes used for recording this ERG signal. So the first type of electrode is the Burian speculum type electrode, and the next type of electrode is the cotton wick electrode. So in the Burian speculum type electrode, so you can able to see that you have a small miniaturized device in which we are placing uh, the electrode over this eye, particularly in the pupil region. And you can able to see in the case of cotton wick electrodes how it is placed. So here a carbon wire or a gold foil, it is used to record the electrical activity in the case of cotton wick electrodes. And these are the different types of electrodes which is used to measure the ERG signal. The first one is jet electrode. The second one, it is the gold plated electrodes which is placed over the eye. And then the thin electrode, which is nothing but the surface electrodes to record the ERG. Then we have the DTL electrodes. Then a loop electrodes, which we call it as HK loop. Then the Burian Allen electrodes. So these are the different types of electrodes used in the ERG. So now these are the waveforms which we have measured using those electrodes. So when you use the Hansen-Burian electrodes, so you can able to see how the ERG amplitude looks like. So it is having the highest amplitude compared to all other electrodes. It is around peak amplitude is 176. The next you see it is a universal jet electrodes, which amplitudes is 162. Then the third one is a Dawson filament electrodes, which amplitude is 121. And the last one is skin electrodes. It peak amplitude is 30. So for when you use the different electrodes, you can able to see that how the performance of the electrodes waveform here. It is given here, and the peak value, amplitude value also mentioned here. So among the different types of electrodes used, this Hansen-Burian electrodes have highest amplitude of 176. And the next is, what is the clinical use of ERG? Why the ERG is used? Mostly for evaluation of any visual activity in infants and children, and to detect any the presence or absence of the retinal function, to evaluate the retinal degeneration, and to confirm any disease are there, any dystrophies are there, and for early detection of retinopathies, and assisting in diagnosing the retinal conditions in which clinical findings does not match with the visual complaints. And what are the factors which affects the ERG? Are physiological factors like pupil dilation, that its constriction is there, um, that leads to affecting the ERG, because in the pupil only we are placing the electrodes over the pupil to record the ERG signal. Then age, as age progresses, for older age people, so definitely there will be a pigment formation, particularly in the cornea of the eye. So this leads to blurred vision. So we have to make some treatment to overcome it. So in that, age is also a very important factor which affects the ERG. Then for male or female, the sexual thing. Then the error and the diurnal variation, dark adaptation, and anesthesia. So when the person is given anesthesia, so they'll feel drowsy. So in that case, we'll find very difficult in getting the ERG